Hello everyone, it's Dr. Dave. Hopefully you're all doing well, enjoying your week, taking care of each other, staying healthy and warm. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Wednesday, February 10th, 2021. I'm going to share with you 6 areas of health and wellness today, as we do most days of the week. And that's how it's gonna go. If you'd like a copy, because somewhere around this video, as I usually mention, you can see those 6 areas and read about them, and check out the references if you'd like to pursue them further. And if you'd like a copy of that, we can get that to you. Just DM us on social, send us an email, call us at the clinic, and we'd be happy to get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, just because you made it here, just because you're putting up with me, just because you're spending the time, I bet that just learning a little bit about health and wellness, being interested in it a little bit, and or thinking about taking actions with some of your own health and wellness throughout the day could end up creating a ripple effect with your own health and wellness in a positive direction. And if it's already good, then this will help keep it that way. So let's see what we can figure out. And it's usually the same thing, just the information is different and always good for you. And sometimes we just mess it up a little bit. But the information we won't, as long as the information is a good source, which I believe it is. Yes, very reputable sources. So interestingly, today we're going to talk about when to wash your hands. The Georgia Department of Public Health in January 2021 came out with this list of strategies for reducing the risk of infection, because you want to wash your hands before you eat, of course. Would make sense. And if you're handling food, you want to wash your hands, especially if it's meat, poultry, or eggs. Which I think poultry is meat, but I guess any of those in those categories. Before and during food preparation, I said that, good. Before applying makeup, before handling contact lenses, before treating a cut or a wound, before and after caring for someone who is ill, after using the restroom, please and thank you, after changing diapers, of course, after sneezing or coughing, after touching animals or pets, and anytime your hands are visibly dirty. So a lot of common sense there, something that we probably already know, even as I fumble through it. But a good reminder never hurts for us to stay on top of it and to support those around us, especially the youth and younger children, to get them into the habits, especially as we know right now. But it's always been and will continue to be an important habit in our day-to-day activities. The journal Hypertension came out in January 2020 with a report on high blood pressure and how it causes atrial fibrillation risk. There can be a problem with the little doors, the valves that operate in the heart, probably if the pressure gets too high. Within 5 years of keeping that high blood pressure, you could have up to a 71% increased risk of those valves not working properly. The journal Neurology, January 2021, says that there are 2 common nutrients that may lower your risk for Parkinson's. They looked at 44,000 adults, and they found an association between vitamin C and vitamin E intake. When those levels were optimized, were a high intake, in fact, there was up to a 32% reduced risk for developing Parkinson's. So an interesting correlation there. If you're into weight, both men and women could be, and if you are, after the age of 50, you can get similar benefits in muscle size and upper body strength. So that from the Sports Medicine Journal, December 2020. The differences are probably a little more favored in one direction versus the other, just because of constitution, I guess, genetics. It may be, not always, there are exceptions, and it doesn't need to separate us, but the research just talks about it. But after the age of 50, it becomes very valuable in terms of stability and functionality to include some weight training, and the benefits seem to level off between the sexes after the age of 50. If you have an underactive thyroid, there might be an increased risk for dementia, especially if you have hypothyroidism before the age of 56. So you want to keep a close eye on your cognitive function, according to the Clinical Endocrinology Journal, January 2021. And finally, exercise and manual therapy after knee replacement as a combination is better than exercise rehab alone if you have a total knee arthroplasty. So it's recommended, if you have that, of course, your rehabilitation afterwards should be very thorough and intensive so that you fully recover as much function in that knee as you can and allow it to integrate into your body function and habits, because things will probably change depending on how your body had adapted or was working around any knee problems prior to that. Hence, exercise will definitely be a big part of it. However, they're finding manual therapy would also be beneficial. So you would want to consider adding that into your routine. All right. So if you end up in that situation, please talk to your healthcare provider and seek out some help with the manual therapy component as well as the exercises. All right, we made it through your daily health update for Wednesday. Tried to keep it brief and a little bit shorter, but I failed drastically, fumbling here and there. But tomorrow we'll go back to a nice calm daily health update. And I hope the rest of your day is calm and that you enjoy the middle of the week. We'll catch up with you tomorrow, Thursday, with our next daily health update. And we look forward to sharing it with you then. Enjoy. Take care.